Hello everyone, and welcome to the National Healthcare for the Homeless Council webinar entitled Local and National Advocacy Strategies. My name is Dan Rabbit, Health Policy Organizer for the Council, and I'll be acting as moderator for today's webinar. Let me begin by first thanking the Health Resources and Services Administration. This webinar would not be possible without their support. Today's webinar will be a one-hour presentation with the last 10 minutes reserved for Q&A. I think this information will be helpful in your advocacy efforts, and thank you again for your interest. So why advocacy? Well, it is essential to the mission of the Healthcare for the Homeless program, but there is more to it than that. First of all, healthcare for the homeless providers and consumers are both natural and powerful advocates. We see firsthand what's working, what's not working, and what's really not working within the human and social services system every day. It's a unique perspective and a perspective that lends credibility to your message. In addition, policy change and advocacy, or advocating for policy change, is the only way to make homelessness rare and brief, an essential part of the mission of the Healthcare for the Homeless program. Homelessness in modern day America was created in part due to policy changes, and the only way that we're going to make our way back to a less prevalence of homelessness is through policy change. So with that, let me introduce our speakers. We have Adam Schneider, Community Relations Coordinator for Healthcare for the Homeless Incorporated in Baltimore, Maryland. James Crawford, Chair of Be More Housing for All, a consumer advocate group in Baltimore, Maryland. BJ Iacino, Director of Advocacy and Education for the Colorado Coalition for the Homeless. And Nick Granum, Program Manager for the Recuperative Care Program at Central City Concern in Portland, Oregon. Our agenda today will be strategies for supporting advocacy by staff and consumers, strategies for effective advocacy in your local community, and strategies for scheduling and conducting effective meetings with elected officials in Washington, followed by a Q&A. So with that, I'm going to pass it over to James Crawford to get us started. James?
Adam and I are going to talk briefly about engaging HCH staff and consumers in advocacy.
If we're going to facilitate greater staff and consumer advocacy, we need to understand first the barriers that we'll need to overcome. We'll start with some that both staff and consumers share.
Most people who come through the doors of HCH Project have serious physical, mental health, and addiction, as well as other problems that need to be addressed urgently. So both consumers and staff are often focused just on meeting the immediate need.
In fact, we all have time to meet all of the most immediate needs, and we need to prioritize even them. Without support from supervisors and support from the organization broadly, it can be difficult for staff and for consumers to feel that they have space to prioritize advocacy in their work.
Both HCH consumers and staff sometimes believe that they don't know enough to contribute meaningful to advocacy efforts. And while it is true that they do not know the ins and outs of policy processes, there's a great deal of experience they have that is critical for policymakers to know.
Some staff and consumers forget that the context within which they work and live, when they can't find housing or shelter, when important health services aren't covered, when disability assistance is frozen or cut, that this context is created fundamentally by public policy. It's created by our social system. They forget that policies we create make a difference, and they doubt sometimes that they can make a difference in these policies.
And a lot of are afraid to do advocacy because it takes them out of their comfort zone.
HCH staff and consumers also encounter barriers specific to their roles. For staff, in addition to lack of time, there's also a push for productivity, to try to schedule another consumer because, after all, there's always somebody else who's in need. Supervisors may not support or encourage participation in advocacy, and many nonprofits and their staff members believe that they can't engage in advocacy without risking their nonprofit status. Of course, we know that this isn't true.
Consumers have many competing interests. They like the resources, flexibility, and their schedule is not of their own. Advocacy is difficult. In our society, people who are the poorest tend to have the least control of their own time. They need to be at the shelter or soup kitchens at a certain time. They have to wait for hours in the service provider site. If they're lucky enough to have work, they aren't allowed. And they can't afford to take time off. And in many places, public transportation increases travel time.
Successfully overcoming these barriers will take intentional thinking about strategies and ways we can provide support. Different circumstances will call for different strategies and tactics, but some of the things that we've found helpful include building advocacy into the organization's mission and culture. In Baltimore, our mission statement says that we will provide health-related services as well as education and advocacy to reduce the incidence and burdens of homelessness. We create opportunities for people to do advocacy, like our annual Homeless Persons Lobby Day, where we close the clinic for services and take staff and consumers to the state capitol for a rally, for legislative hearings, and for meetings with policymakers.
In order to facilitate successful advocacy events like Lobby Day, HCH and Be More Housing for All inform staff and consumers about what's going on and how they can be involved. We hold briefings on policies discussed for staff and clients, and recently our consumer advocacy group, Be More Housing for All, has started its own newsletter written by and for people without housing.
These events and activities, in addition to the external coalition work we do and our Faces of Homelessness Speakers Bureau, provide diverse opportunities for people in which they can engage and through which they can grow. Just as we try to be creative about the ways that we engage consumers in service, we need to be creative about the ways we engage both staff and consumers in our advocacy efforts.
Be More Housing for All meetings are not only a place to share information, it is also a place for support and solidarity. Advocacy is hard work, and change often comes slow. It is important for us to find ways to support one another in this long struggle.
These events and activities are not only ways to engage, but they're also ways for us to practice. It takes a lot of practice to hit a fastball, something that I've never been able to really do, or to master a Bach concerto. However difficult these things are, changing the world is even more difficult, and it requires much more practice, intentional reflection on both our successes and our failures.
And of course, the first rule of organizing is to provide food. This is especially important when people with whom you are working, like many of HCH consumers, have limited access to food. We don't want anyone to have to choose between advocacy and eating. If we're going to put forth effort to increase staff and consumers' emergence in advocacy, we should understand why it is important.
As Dan said, one of the main reasons that staff and consumers are so important to effective advocacy is their credibility, inherent credibility. They know better than almost any elected or appointed official the challenges being faced by people living in extreme poverty. They know how hard it is to make ends meet. They know how hard it is to secure the resources to meet the most basic of needs.
This expertise, which comes from first-hand experience, is more authentic and powerful than the testimony of any paid lobbyist.
In addition to their authentic voice, people struggling directly with the challenges of homelessness have a vision. They have a clear vision of a society without homelessness. It just doesn't occur to them that we should be content to manage the problem. This vision infuses the work that we need to do. They understand, to quote one of our friends' artwork, that everyone deserves to go home.
If we're going to build a real people power, we need to have people who are empowered, making real change for themselves. We need to help develop leaders. Token participation just won't bring about the change we seek.
Advocacy also builds solidarity. Now, boundaries can be important, but solidarity isn't consistent with well-established clinical boundaries. Solidarity is rather the recognition that our destinies are intricately bound together and that we will stand together with one another against injustice. I think of the old saying, if you give me a fish, you'll feed me for a day. If you teach me to fish, you'll feed me until the river is polluted or the shoreline is seized for redevelopment. But if you teach me to organize, if you teach me to advocate, then whatever the challenge, my community and I can join together and we will fashion our own solution. That's the purpose of advocacy. Now, we're getting short on time, but we want to close out this part of the webinar with a few examples of consumer and staff advocacy and how they were effective or not. This past session of the Maryland General Assembly, the legislature considered a bill that would require the state to inform parolees of the exemptions available to them to the monthly parole supervision fee. Critical to the passage of this bill was a recently released HCH client who, during his testimony, held up his release paperwork, which stated that he would be violated and sent back to prison for failing to pay this fee. The first fee payment, by the way, was due 1 day after his release. The paperwork, however, gave no information about the exemptions that were available to him. Before the hearing, we gave him information on the bill. We talked about what he could expect at the hearing. He practiced his testimony, and his case manager drove him to the hearing and sat with him at the hearing table. It was impressive organizational commitment and solidarity.
We'll talk more about this in our workshop at the conference. But 2 years ago, as Maryland, like many states, were looking to cut the budget, the Department of Human Resources planned to cut the state's temporary disability cash assistance program. HCH consumers interviewed about 800 program participants. The result report was used successfully against the proposed cut. It took a lot of work, and the consumers were critical in all aspects of the campaign. Empowering a lot of people who never conducted research, testified before the legislation, met with Department of State, or organized their own human rights budget.
A lot of us have had the experience of being moved along or having our clients moved along. The experience here in Baltimore shows two types of advocacy. The first, legal advocacy, several years ago when there were more than 900 incidents of people being moved along by local police and local organizations, attorneys got involved and sued. And while it was on behalf of a class of people, what it took was a couple of people to stand up for that group. That was really successful partnership between local attorney advocates and people who were experiencing homelessness. More recently, a group of people who were living under an interstate in downtown Baltimore were similarly being moved along. What they did was create a very intentional community of solidarity amongst one another and with other people in the community. They scheduled and conducted visits with local officials, and what ended up happening was that the city put them up for the winter in a hotel while Section 8 vouchers were processed. Today, they're housed and they're getting services. It was a way of ending homelessness not only by reaching out to people and providing effective services, but engaging them directly in advocacy. We're going to have, as James said, some workshops at the national conference at this, and we hope that you'll attend. But for now, we want to turn it over to BJ to talk about strategies for local advocacy.
Thanks, you guys. Hello, everybody. I'm real pleased to be taking part in this discussion today. I'd like to acknowledge that Adam and James just now and Dan have given us a really nice overview of key guiding principles and important points in in why we're even on this call, why advocacy is important. As a matter of fact, Dan's point that homelessness is caused by policy should be up on a wall in all of our offices, because I think it's the central point of our discussion. But I'd like to talk a little bit about how we've put these concepts into practice here in Colorado at the local level. And I'd like to begin with just a little bit of information about our organization. The Colorado Coalition for the Homeless is one organization that provides housing and health care and support services all under one roof, so to speak. We have 15 housing developments and a number of different locations where we provide health care and satellite care and child care and other services. But we actually began with just several people and health care, and so advocacy works because for the past 25 years education and advocacy, as has been recommended today, has been part of our mission statement. Not only has it been part of our mission statement, but we've also been really fortunate to have a very powerful and dynamic leader in our president for the past 25 years, and he has championed these issues and the importance of education and advocacy, and he continues to teach us all, and we teach each other, that homelessness really is caused by policy. So it is my privilege and pleasure to manage a small department. We have several staff members who are dedicated just to do this work. Federal and state and local legislative advocacy, as well as media relations, public education, and just about everything we can think to do to create a hospitable environment in our local community to help us serve as many people that come to us every day that we can. And I'm sure you all are experiencing this, that for us advocacy couldn't be more important, because our numbers, we're getting slammed. Our numbers are just higher than they've ever been. For example, for our mental health services, we have 2,000 people on our waiting list. So advocacy is essential. And this local focus is also incredibly important. I don't know about you all, but we're not always welcomed when we come into a community, when we want to build a housing development or operate a program. We have to do a lot of work with our elected officials and the other influencers like community organizations in that area that have a strong influence on whether or not we can deliver what we intend to do. So I would say that the first step, if you take a look at the slide here, the first step really starts with establishing a local connection with a geography lesson. Identify where your program is located. And I'm hesitating there for a minute because I think that some of you may be standalone, some of you may be affiliated with a community health center, some of you may be situated in a broader service delivery setting like a hospital, and some of you might be situated in a health department. So identify the network within which you live, put a pin in it on the map, and start first with who are your city council representatives. And that is essential because from a policy perspective, which really is so totally linked to targeting resources that are available from your city leaders, and oftentimes that comes from the state, and oftentimes that comes from the federal support. But it's identifying what council members have a vested interest in your program and your network of programs. And if you're envisioning this sort of city or even a state map, but if you're envisioning the city map where you might reside, don't think just of your HCH program, for example. If you refer your clients to other case managers, support service providers, housing, supportive housing providers, think about the network within which you operate. get a mental image, get a physical image, put a map up in somebody's office so you can see where you are, and attach to that who your city council members are. And as you're doing that work, then identify who are your state Senate and senators and representatives that also have a vested interest in those programs. And when you have that in front of me, then you have a sense of the critical mass of those elected officials that you want to influence. So that's the first step. The second step is then looking at key state committees that the second step is looking at what committees those legislative members might be part of, and then you have the group that you want to focus on. So
what you're looking to do is creating staff extenders. You're looking for ambassadors for the work that you're doing, and city council members and the constituents that support them are your greatest allies. And the second thing I would suggest is identify who's in your mayor's office, who's in key staff positions, and whether or not they have a 10-year plan, because that gives you an long-term objectives. And I expect that I'm speaking to the choir a little bit on this point because so many of you have had to engage in some local level advocacy to really even carry out your programs. But let me make just a couple of points here. When you work with any elected officials, make sure that you're staying within the confines of whatever your state and federal IRS rules are about what you can do and what you can't do from the perspective of advocacy. Pay attention to your election cycles so that you know when people are coming on and off, coming in and out of their office. And during that time is when you really just want to make personal connections. It's all about personal connections. If you have an event that's coming up, certainly the National Community Health Center Week that we're all encouraged to participate in is one. There may be other activities that you're engaged in. You may be buying new equipment or starting a new program, and all of that has interest locally. And that's the time you give a call and you ask. That creates an introduction, and you can generate some support that way. And another point is literally just to contact them and say, you know, we're in your district, and would you like to come and take a look at what we're doing and get to know us better. And all of these other points that are on the slide are pretty self-explanatory. The last piece is I always feel like these recommendations that we make overwhelm people because we are so fortunate that we have a team here at the Coalition that can do this, but most people don't, and it really is other duties as assigned for a lot of people. So work to get the support of the leadership of your organization, and then find some political science students, or any kind of student really. Work with their instructor, the faculty of a local school, even high school, and see if you can get them to help doing some of this administrative stuff that helps you build these connections. The next piece is, so you have political advocacy, you're trying to create personal relationships with elected officials, and what can you layer on to that that's going to really leverage and maximize those connections? And it's media advocacy. It's not just getting the attention of the media, it's being aggressive and proactive in encouraging them to tell the story that you want to tell. And on this point, everyone is always a little bit frustrated here too. How do you build a media list? What do you do? It's the same thing as just establishing a relationship. This time, instead of looking at who is, making a geography map, this time what you're doing is you're looking at who's writing stuff you like, who's covering poverty, who's covering homelessness, who's covering health care, and look at it in terms of print, TV, radio coverage, online. You can use Google News Alerts. It's a simple service where you can phrase appear. And when somebody reads your attention, make a note of who that is and give them a call and tell them your story. See if they want to come and tour your program and just get to know them a little bit better. For us, we really have taken advantage of this. one of the things that we discovered through this work is that a local reporter for the national PBS NewsHour is right here in Denver and happened to know one of our staff members. And so we were able to leverage that connection into a national story about our mobile health unit when we lost funding for it. They covered it when we lost the funding, and they covered it when the funding was restored. We also took advantage of some of those relationships when the Denver the mayoral election was recently held, and so we formed a coalition of other service providers around and invited all mayoral candidates. There were more than a dozen of them, to a debate, but the relationship with our local PBS affiliate helped us establish them really as the host for it. It was a very successful event. Two other things that we've been able to do in terms of telling our story is that we advocated in our state this year hate crimes legislation to introduce crimes against the homeless within our state hate crimes statute that would instill stiffer penalties on individuals that committed crimes against homeless individuals because they were homeless. So that was a legislative action that we really led at the state level that we were able to maximize from a media perspective. And then another thought is, you're all aware, I hope that you all are on all of these email lists of all the national organizations when they release their reports, like the National Low-Income Housing Coalition's Out of Reach report. There are so many. The United States Interagency Council on Homelessness keeps us all apprised of what's happening, what's released. And when those reports come out, they usually have a state and local angle. That's an opportunity to call up a reporter who you like and just say, wow, here's what we think about this, and we have a good story to tell around that. I think journalism students are also a good connection for just some staff extenders. If you have a local press club or any kind of a social organization where you could connect with people in communications and journalism, that makes a lot of sense. And if you have a website, think about what you do from the perspective of virtual outreach. That would really that really enables you to do more with less. And then, so this was just sort of leading this thread, this train of consciousness here from, who are our local level elected officials, who can we connect with in terms of reporters that may tell our story. Then the next step is really to think about how you put it together in terms of who gets things done. In the end, it often comes down, the phrase, the devil's in the detail, it's really into the administrative detail. And it's often the state agencies and city agency officials that have sort of the authority to make decisions on city council decisions and state legislative decisions. So you'll want to use your connections with city council members and state representatives to influence those state agency decisions. And in Colorado, just like in Baltimore, where I know that you all, it was earlier mentioned, this disability benefits advocacy. In Colorado, it's called Aid to the Needy Disabled, and we almost lost it. And it was through this work that I've just described and putting some pressure and putting that to bear on state agency officials in those decisions that we were able to restore that. So now you're talking about blending. So you're blending, media influencers with elected officials and the organizations within which you work that have some kind of influence over what you're doing. And again, I think this is pretty straightforward. I think to wrap it up, and I apologize for the little technical blip, but I think that's a good cautionary tale, for this is what happens all the time. It's discouraging. People don't naturally tend to support what we do. So just a couple of things is that remember that you're connecting with individuals. You're wanting to change communities, but find people to connect with and know how to ask what you want succinctly and quickly for your organization, and don't lose your energy. You have to keep the fire lit. This takes a long time to make gains in the work that we're doing, and work really hard to get at least one FTE in your organization who can really be the coordinator for this kind of work. It'll make all the difference in the world. And when people oppose you, don't take it personally. It's not about you. Understand how they think and try to overcome it. And remember, most of all, that success does happen. And actually, it happens all the time. So shake off your frustration and keep on swinging. And I'm very happy to turn it over to Nick.
Thank you, BJ. That was very good. I look forward to just saying a few things about going to the Hill. The goal of my comments is really to help ease concerns if you haven't been to the Hill in DC. And I'm going to talk a little bit about logistics, and I'm going to forward the slides here. A little bit about logistics, and the point of this is really that it can be a lot of fun to go to the Hill and talk about what we do and tell your story. But it's really important that we do it in a coordinated fashion, and we get there and they really hear what we have to say. So I'll also talk quickly about the anatomy of a meeting and kind of what to focus on. And my goal really is to help ease concerns, because this is a representative government, and even though sometimes it doesn't feel like it, they work for us. And so as a voter coming from your district, they really do work for you. And the staff in each office is set up to hear what you have to say and make sure that your voice is included in policy decisions going forward. So if you're coming next week for the conference, as soon as you hang up here, maybe call your office and get a meeting set up while you're in Washington, D.C. You can call the office scheduler and ask for an appointment generally with the health aide or the legislative aide that has health care or homeless issues on in their portfolio. There'll be, for example, you can call Representative Earl Blumenauer. He's one of our representatives, and his number is on the screen. An easy way to find your own representative is to just type U.S. Congress and your zip code into Google, and it'll come up with generally the website, either the local office or the DC office for your representative. And so once you've contacted them, a lot of the folks working on the Hill are either in college or just out of college and are comfortable using email and all sorts of different things. So don't hesitate to communicate often with them by email. You don't have to just call. So one thing I want to say about this also is each office is kind of like a small business. The member of Congress or the senator is kind of the lead of their own small business. So each office kind of has its own personality, and some of the people working in each office are local. Some are local to DC, but some might be from your district as well. So so don't hesitate to embrace the technology that they're using. Yeah, and again, make sure you call right away. If you are, once you get there to DC or right before you leave, make sure you call a couple days before to confirm the appointment. Sometimes things change. And it's going to be important that you're meeting with a staffer. Sometimes you'll feel like, oh, I really want to meet with the member of Congress, but they may not be there, or they may not have our particular issues on in their portfolio, because there's so many things going on that the office has to deal with as an entity. They may not have health care as the specific thing that they're working on. Although they're following every issue, they have staffers that are particularly following each issue that they can keep them up to speed on. So also, if you use Twitter, don't hesitate to follow your congressman or a senator on Twitter. You can kind of get the inside scoop as to what they're thinking about on a regular basis. They don't all use Twitter, but and that's not necessary, but it can be fun to hear what they're thinking about. So on the day of the meeting, when you get there, make sure, when you get to DC, make sure you know what you're asking. The resource room at the conference will have packets of information to take with you. It's really important that we all show up with the same information. It's easy to have a lot of different issues that we're thinking about, but if we all get to the Hill and during this time ask for the same things, they're all talking to each other. Sometimes it doesn't seem like it when we hear on the news that they're arguing, but the staffers in each office definitely talk to each other on a regular basis about issues that they're hearing about, and they'll hear, oh, I had somebody from Healthcare for the Homeless here today. You know, what did you hear about from them? And so they're going to be there's a lot of dialogue going on, so it's important that we're consistent. So bring those with you. Also, make sure you wear clean business attire. I know that's maybe obvious, but it can be easy to kind of everyone on the Hill has a shirt and tie, and it can be distracting if you're wearing something else. Don't worry about it too much, but just make sure you're clean and appropriately dressed. So then they don't remember seeing somebody that was in shabby tie. They remember your story. So and sometimes another thing about logistics, their offices can change. Things move. People leave Congress suddenly in the middle of the time. So make sure you check the directory when you get there. Really quick, just looking at a map. I like this map because it shows pretty dramatically. A lot of people think that the work happens in the Capitol, but most of the work is actually happening in these office buildings on the right and on the left. The Senate is on the right side of your picture, and there's 3 office buildings there, and then the House is on the left, and there's 3 huge office buildings there. So a lot of members of Congress, and so a lot of offices. And so in case you haven't been to D.C. before, the Capitol is the center of the city, so everything in the upper right-hand corner of that picture is northwest. If that helps, the hotel for the conference is up in that area. So we're actually pretty close to the Capitol itself. But it can look small on here, so just remember that it can be a long walk from one side to the other. So if you have meetings that are close together, make sure you leave enough time to get across the Capitol. If you have 2 meetings on the House side, every building has essentially airport security. So make sure you can enter one House office and then stay on the House side and just go all the way to the basement and take a tunnel, and you don't have to go through security again and again. It's especially helpful if it's a rainy day, so you're not going outside. So how do you get there? Obviously, this may be review for some people, but make sure you leave plenty of time. You can walk from the hotel. You can walk from wherever you are. There's also a metro. If you're running late, taxi is just a few dollars. But most of the city is very walkable, so don't hesitate to just go right there. So the meeting, this is kind of the most important part and kind of the most fun part. Be flexible. It's it helps to break it down.
Okay, so sorry folks about the technical difficulties. So I'm going to pick up where Nick left off, the anatomy of Hill visit. I'm not really sure where on the slide Nick stopped, so forgive me for any redundancy. But the way the meeting really goes, you have 15 minutes. The first 5 minutes should be devoted to introducing who you are, where you're from, why it's important, the connection to the elected officials district or state, what you offer for the elected officials district or state. Another 5 minutes is to tell your story and introduce your issue. So for instance, if you wanted to talk about increasing affordable housing, you would want to start introducing the issue in the middle chunk of the meeting. So how many affordable units are there now? How has it changed over time? What can be done about it? And then it's always good to substantiate statistics and facts with a story. So how has affordable housing helped you or someone you work with? Just to continue to use this as an example. And then the last 5 minutes should be your ask. It should be a very clear statement of what you want the elected official to do. You shouldn't be afraid to ask for a commitment. You might not get it, but you should at least frame it in such a way. If the elected official or the staff, more likely, kind of sidesteps to ask about the commitment, offer to provide more detail, ask what their concerns are, and go from there. And of course, always follow up with a thank you note, build that relationship, and keep that going. I think we have another minute or two before we go into Q&A. So just a couple other thoughts about Hill visits and scheduling a meeting. I guess how you respond, let me just go back one slide. So how you respond to the ask. If the elected official says they're supportive, or I know I keep saying elected official, but really it's more the staff. Don't expect to speak to staff. There's nothing wrong with speaking to staff. Really, staff are the only people with time to make policy decisions and gather information anyways. So you're probably going to meet with staff. When you meet with staff and ascertain how they feel about the particular issue you're talking about, how they respond is going to determine how you proceed. If they indicate strong support for the issue, thank them for their support, thank them for their past support if it exists, and with their strong support, make sure to ask them to speak to their colleagues or their leadership, or have their boss speak to their colleagues and their leadership, or to take a leadership role, to be a champion, they say, for the issue. If the person's undecided, again, offer to provide more information, offer to follow up at a later date. If the person does not support what your ask, whatever policy priority that you're discussing with them, then try to figure out where their lack of support comes from. But otherwise, thank them for their time. Don't burn any bridges. Today's ally or today's opponent could be tomorrow's ally. That's something to keep in mind. And also just always remember that advocacy, especially advocacy by HCH staff and clients, is about education. So you don't really need to know the meat and potatoes of the policies in play. Just going to explain what you do, the problems you see, and some common sense solutions that you know of can be helpful. So with that, I think we're going to turn it over to some questions. Let's see what we have here. Sure, I'm going to try to pass the mic over to Nick, see if Nick's back up and running. The question is, do we have information sheets, like talking points, online at the council to use and adapt for our visits? Actually, I'm going to take that question. I am the legislative advocacy staff for the council. Yes, we have tons and tons of talking points.
Thanks, Dan. So the question from Ralph is, any opinion on seeking a letter of support for a grant application during a Hill visit? And my bias is that it's easy to distract from the visit with other issues. It might be good to set up 2 visits for if you have 2 things you're doing, if you're seeking support for a specific thing at the local level, or ask for a chance to follow up with them. But it can be important during your initial Hill visit to just have to stick to the issue, kind of the national issues that you're wanting to focus on. And hopefully that helps for people to. It's easy to get distracted on hot button issues or local issues. But since if there's going to be a lot of people on the Hill at the same time, it's good to stick to a consistent set of issues. So hopefully that helps.
Okay, thanks, Nick. Our next question is what's going on right now in Washington, D.C. that is impacting healthcare for the homeless facilities across the U.S., coming from Lindsay. I'm happy to take that question as well. There's a lot going on. Our policy priorities right now, like I referenced about the publications that are available on our website, our big immediate policy priorities are maintaining and expanding health center funding and preventing a Medicaid block grant or any other type of cuts to Medicaid funding, Medicaid enrollment. Why those are important right now, the House Appropriations Subcommittee that handles health center funding is going to be marking that bill up the end of July. The talks you guys might be hearing in the news about the talks about the debt ceiling and the implications of that, the spending cuts that some in Congress want in exchange for the debt ceiling. So that might circumvent the usual appropriations process entirely. So right now, as we speak, Vice President Biden and congressional leaders are meeting to try to work out a deal to raise the debt ceiling in exchange for long-term deficit reduction. Not to go into too much nitty-gritty detail, but this long-term deficit reduction is probably going to be a lot of spending cuts and not a lot of revenue additions. The cuts that are going to happen from that are probably going to be cuts that either harm our projects or our patients. So right now and next week during the conference is a really timely time to be doing Hill visits, getting the message out about the programs that our clients depend on, the funding streams that our projects depend on, and the benefits of our projects to the local communities of elected officials. So those are some things that are happening right now. Again, Medicaid and health center funding are our big priorities. So we'll move on to another question. This one comes from Margaret. Do you have any tips for working with public officials that have different political views than you? I'm going to pass this one to BJ, just because BJ hasn't answered the question yet. BJ, are you still with?
I do. The first thing is to respect them, that it's okay that they have a different political view, so that kind of minimizes kind of the antagonistic attitude that might exist that's so tempting, I think, for all of us. And then the second thing is look for some common ground. Kind of try to understand what it is that's causing the opposition. Is it an opinion that's stemming from members of their constituency? Is it a concern about cost? Try to find a place where you can enter the conversation in sort of an equitable place. If they're concerned, if it's a NIMBY issue, they're concerned about your program or your work in their area, then try to find a champion, a peer that can speak on your behalf and help you persuade them. If it's a cost issue, look for ways that you can make your argument from a cost perspective. I'd say fundamentally the bottom line is look at who their peers are that they respect and attempt, who may not have as strong an opposing view, and try to work with them to help whoever your target is better understand. And if you can get a face-to-face meeting with them, that's the first goal. And then second, if you can get them to come to your program and see firsthand the work that you're doing, that generally has a very positive outcome.
Thanks, BJ. Our next question comes from Heather Russell, asking about continuum of care, I believe that is. The question is, I'm having trouble getting my continuum of care to start a 10-year plan. Can you give me advice on how I can motivate them more and inform them how important a 10-year plan is? I'm going to pass that one to BJ as well.
The simplest strategy there is really to look for the strongest influencer you've got around that. And I would suggest, as been our experience here in Colorado, is to look to your governor's office. Most states have governor's advisory councils on homelessness, and I think taking up the matter with anybody you can access on that council, most particularly whoever is coordinating that group for the governor, but anybody that you can access, and begin to educate them about the importance of long-term coordinated planning. And the second thing is everyone might want to take advantage of the HUD report that was released today to Congress on homelessness. That's a real good right now opportunity to put into action some of these recommendations we've been making today based on, you know, a national report that could trigger some of these conversations.
Okay, well, thank you, BJ. I don't know if we lost you or if that was the end of your response, but it's time to wrap things up, guys. That will include our Q&A session. I want to thank everyone for attending. And before we go, I would like to point out here's some more information about some of the advocacy materials we were discussing. This includes our conference, the website for our conference, my email address if you have any questions, our regular advocacy page. One remaining slide is just some information about the council, our regular website where you can go to become an individual member. It's free and offers lots of great benefits, and where you can go to sign up for council policy advocacy alerts called our mobilizer. I'd also like to point out upcoming webinars in July. And thanks again, everyone, for attending. Hopefully I'll see some of you guys in Washington.